Hi, my name is Bethany Mundy-Bossi, and I'll be talking to you today about the role of natural killer or NK cells in acute myeloid leukemia. So we know that immune surveillance is critical, and studies in patients with primary immune deficiencies and extensive animal modeling studies have demonstrated the need for intact immune system in controlling cancer. Further, studies by Velarde et al. In the early 2000s demonstrated that in AML patients receiving hematopoietic stem cell transplants, the ability of NK cells to recognize the leukemia predicted outcomes, and specifically, patients with NK cells who were able to lyse autologous targets in vitro had significantly improved overall survival. So great, NK cells will cure AML. Why are we not using them more? Unfortunately, we know it's not that simple, and first we have to understand the biology behind how NK cells develop and function to be able to utilize them effectively to treat patients. Previous work by our group and others has demonstrated that mature NK cells are not fully functioning in AML patients, but this appears to be only part of the story. We discovered that in addition to defects in mature NK cells, NK development is altered in both a murine model of AML, but more importantly, in AML patients. NK cells are becoming blocked at an early stage of development, which creates a buildup of immature NK cells, and fewer than normal mature cells escaping this blockade. And we already know that the ones that do escape are less functional. So what exactly is causing this problem? To ask this question, we first isolated NK cells from a murine model and AML patients and discovered that two transcription factors critical for NK cell development called TBAP and eomes are altered in the NK cells in our AML model and in AML patients. We started to look at what directly regulates these transcription factors, and drawing from some earlier work in T cells, we discovered that a microRNA, miR29B, has the ability to regulate both. When we evaluated miR29B expression, we discovered it was elevated in the NK cell compartment. So we found that miR29B is up and NK cell development is inhibited, but we still do not really understand why this is happening. So this really became the focus of my recent work and what I proposed for the TRTH program. The lab where I did my postdoc had previously determined that a transcription factor called the aryl hydrocarbon receptor, or AHR, can determine NK cell fate. When we looked at this pathway further and activated AHR in NK cell precursors in vitro, we saw a pattern similar to what we see in AML patients. Could there be a link between AHR and upregulated miR29B in AML patients? We tested AML cell lines in primary AML patient samples and discovered that they indeed produce soluble factors that activate the AHR pathway. Co-culture studies with NK cell precursors and AML cells demonstrated a block in NK cell development, which we could then reverse by inhibiting AHR. We subsequently went on to show that AHR binds to the promoter of miR29B and leads to the upregulation of miR29B in the setting of AML. So great. We have this novel target, AHR. What do we do with that now? So now we're focused on translating these studies, which means validating the role of AHR inhibition in more complex settings, understand the impact this has on GVHD, immune cell reconstitution, AML progression, etc. But most importantly, working with companies to find a good clinical candidate to do these tests. Okay, so that essentially sums up the past 7 or 8 years of my life in less than 4 minutes. Now, how did I get here and what role did the ASH-TRTH program play in this process? So the ASH-TRTH program came along right at the transition from postdoc to faculty. It became very instrumental in defining my scientific mission and the start of my faculty career. I had some very bold, lasting impressions of my time with this group, but I wanted to share a few take-home messages. Number one, tumor biology is a big world, and you only represent a very small piece of the puzzle. Number two, reviewers are from diverse backgrounds. And number three, your grand ideas are not the center of the universe, so don't expect others to immediately grasp why you should care. Number four, however, with all of this being said, many people are willing to help if you know how to frame the question correctly and know how to ask. But finally, most importantly, I learned that you need to have confidence in yourself, your ideas, and your training first, or no one else will. The TRTH process puts you on a stage where you're literally defending, in mostly a good way, every piece of your future career. And if it can be uncomfortable for even the most outgoing of trainees at times. However, if you're confident in yourself, while still leaving room to listen and consider the input of others, TRTH can help you navigate the tumultuous waters of becoming a new faculty member and will send you off on your way to creating a successful research career. Thank you.